The response rate was reported or analyzed as a secondary endpoint in this study. It's important to remember that in a maintenance study, patients can enter the study having had a complete response to first-line chemotherapy. There are some different schools of thought in terms of whether or not those patients should get a switch maintenance approach or shouldn't. One could argue that those patients actually might have the most to gain by a switch maintenance approach in terms of really moving the bar in trying to cause a real durable complete response in patients with this disease. On the other hand, if chemotherapy has done a really good job, of course, one might say that those patients should be offered a treatment-free interval. And the numbers will be small, but ultimately we'll be able to look at the subset of patients who had a CR going into the study, randomized to pembrolizumab versus placebo. One of the reasons for mentioning that, though, is that patients who are in a complete response when entering the study obviously have to be taken out of our objective response analysis because there's nothing to measure in terms of the response assessment. The remainder of patients, which was the majority of patients on both arms, about 10 patients came into the study with a complete response. That's out of 50 to 55 patients on both these treatment arms. Of the remaining patients, the objective response rate on the placebo arm was 10%. So another lesson, it's always important to remember that responses to first-line chemotherapy can continue to evolve even after that treatment's discontinued. On the pembrolizumab arm, though, the overall response rate was 22%, so it was numerically higher, and the complete response rate was certainly higher. It was 9% compared to none on the placebo arm.